Hello. In this post, we will look at a strip with two rhythms. Can atrial fibrillation be regular? Yes. This can happen in atrial fib with AV block and an atrial fib with AV dissociation with junctional, subjunctional, or ventricular rhythm. Even rare is AFib that is regularly irregular. Look at this strip. Look closely and move backwards. Do you see something strange with this atrial fibrillation? How come this AFib becomes a irregular rhythm? AFib by definition must be irregular. How did this happen? How did this happen? So the rhythm strip shows a regularly irregular rhythm with group beating. So the groups are 2, 2, 2, 3, 3, 2, and 2. In the group with 3 QRS, there is shortening of the RR interval from 0.52 seconds, then 0.48 seconds. Then the RR interval between this group is about 0.76, or it's less than 2 times the RR interval of the preceding interval. If you're familiar with the works of Dr. Marriott, group beating is a footprint of a winky buck. Atrial fib cannot do this precise grouping. So in this case, atrial fib, as shown in our ladder diagram, there is an entrance block. Entrance block denotes failure of an impulse to reach, enter, suppress, reset, or discharge a dominant pacemaker. So our next dominant pacemaker, or our dominant pacemaker in this case, will be the junction, or the AV junction. So how do you compute for the AV junction looking at the existing QRS? Number 1 is to get the RR interval between the beginning of a cycle to the beginning of the next cycle. In this case, it's about 45 small squares. Number 2 is to divide that RR interval with the expected supraventricular beats. In this case, we're thinking of the junction. So we're looking at a group of 3. So we expect that there will be 4. So we're thinking of 4 to 3. So 45 divided by 4. So there'll be about 11.25 small squares. Next, we get the rate by dividing that 11.25 by 1.5, and so we get 133 beats per minute. So we're talking here about junctional tachycardia. This whole thing is best appreciated with this highlighted ladder diagram. So atrial fibrillation has an entrance block, and we have junctional tachycardia firing at about 133 beats per minute. However, this junctional tachycardia has some problem exiting. So we call it an exit block. So the interpretation for this rhythm is atrial fib with entrance block plus junctional tachycardia with a winky buck exit block, or a type 1 exit block. So next time you see a fib that looks regularly irregular, think of a phenomenon think of a phenomenon like this: atrial fib with an entrance block and a junctional tachycardia with an exit block. I hope you like this strip.